today I am doing a day in the life of a medical assistant. I work in a surgery center and we are working during the coronavirus. The reason why we're working is because a lot of the patients that we see have infection and pain, and if we don't treat them here, they'll go to the emergency room and they'll try to be treated there, and the emergency room is already overloaded as is, given the coronavirus. So that's why we're still working, and I'm just gonna bring you guys along, show you guys everything that I do during this outbreak where we have limited supply, limited staff. All right, stay tuned. All right, so a little bit about where I work. I work at a surgery center for kids. We are open during this pandemic. We are running out of supplies. Actually, you'll see later in this video that I had to reuse gloves for the entire day. It is getting worse and worse as the days progress. We're running out of masks. We're running out of different things that we need to keep the surgery center up and running. But the community has been really helpful in sending supplies like local dental offices that are closed and things like that. So we are trying our best to serve our community and still remain safe. So we definitely sanitize a lot and, trying to wash our hands and prevent, outbreak, even though we may or may not be getting exposed because we are seeing patients. Okay, so what you guys are seeing here is I'm setting up for sterilization. In between surgeries, I have to sterilize all of the equipment that's used, and this is the first part of sterilization. Those right there, those are the gloves that I'm reusing for the entire day for sterilization. Sterilization, the first part of it is basically cleaning, packaging, and then putting them in the autoclave where they get sterilized. This is the little tab that I put in the ultrasonic, which is basically going to super clean any bacteria, microorganisms off of the utensils. And so what I clean is the surgical equipment and the anesthesia intubation equipment as well. And you guys will be seeing that throughout the video. Please note that though I am recording where I work at, and there's no problem with me recording where I work at, I can't show other medical professionals and I can't show any patients. So I try to get the best angles for you guys, but you can't always do that. So hopefully you guys enjoy the video though. So this is just a view of the actual surgery room. This is from a Snapchat video, so sorry for zooming in and out, but you guys can see the anesthesia machine that I usually clean off in between surgeries, which I'll be showing later, and just the general area that we're working with. Again, going back to sterilization, just cleaning the utensils in between surgeries, very, very important for infection control. As you guys can see, I'm taking out the instruments and I'm not scrubbing them again because I've already scrubbed them before I put them in the ultrasonic. The ultrasonic purpose, like I said, is just to provide a deeper cleaning. So that's why I didn't have to re-scrub them. So what I'm doing now is just placing all the instruments in their individual sterilization bags and placing an indicator in each bag. The indicator will turn a blue color, which will tell me after the sterilization is complete that the autoclave machines actually sterilized the equipment. Now I keep the water running because as I am packaging each instrument, I am checking for blood. I'm making sure that there is no cement or anything that they use in the surgery room left on the instruments. So I have to occasionally re-scrub the instruments. So that's why I keep the water on. It's really important to make sure there's no blood and no cement or anything from the surgery room, because ideally these have to be very, very clean for the next patient. So I have a bunch of other responsibilities that I do in between all of these things. One of them is cleaning the beds in PACU once the patient is discharged. I wasn't able to get a good recording of that because of people coming in and out and patients being able to see. However, I do have some pictures, and you can just see like the circuits and the blood and all of the tubing that I have to discard and clean off. And I basically just put new sheets on that and put it in pre-op. Other things that I do is help the patient get acquainted in pre-op. I translate for the nurses and the doctors when they need it. I also can set up the IV fluid bags, help get the first set of vital signs, and anything else that the nurses or doctors need me to do. So what you guys are seeing here are the autoclave machines. These machines are responsible for sterilizing all of the equipment that we use day to day, patient to patient. They sterilize by using high temperature and distilled water. They're very, very important. Like I said, essential to the business. They basically kill off any bacteria or microorganisms or pathogens that cause illnesses, viruses, things like that. So very, very important thing to do all throughout the day, so that way we can have equipment to continue doing surgeries. Okay, so I'm finally taking you guys into the OR room. Like I said earlier, I try to get the best angles for you guys, but I can't record anybody else in the facility, so this is the best that I can do. As a medical assistant in the surgery center, I am responsible for turning and flipping the OR room so that way we can get patients in and out as fast as possible. What I'm doing here is cleaning off the equipment. You guys saw me spray that blue and white bottle. That's a biocidal. I don't normally spray that when I clean, but I do now because of the coronavirus pandemic that is going on. Also, earlier you guys saw me remove the tubing, the suction. That is when they suction the patient's mouth from all of the dental surgery that's going on. It's usually filled with a lot more blood, but I'm responsible for removing that as well and replacing it. The tubing that I was cleaning off towards the left side is a little bit cut off, but that is your oxygen saturation, your ECG, and your blood pressure tubing, as well as the oxygen tubing that the circuit goes to, which attaches to the anesthesia machine, which provides all of the gases during the surgery. Then to the right, that black box to the right is with all the anesthesia supplies that has your narcotics, your intubation tools, your trach tubings, all the things that they need for the anesthesia portion of the surgery. And here I'm just mopping the floor. I know it's out of frame, but I have to mop the floor between every surgery because there's usually blood and cement all over the floor. I was unable to film an outro for this video because I got really busy at work. However, I included some pictures of our sterilization rooms. Like I said, we are running out of supplies. We're double masking, triple gloving. We're wearing patient gowns just to prevent any fluids from getting on us during the surgery and throughout the whole time patients are in the facility. And like I said, I was reusing gloves. So guys, please stay safe. Please wash your hands. Stay inside when you can. I really hope you guys enjoyed this day in the life as a medical assistant video. Let me know if you guys have any other videos you guys want to see. And be sure to like, comment, subscribe, and turn post notifications on.